Celebrities Christina Applegate, Sharon Osbourne, and most recently Angelina Jolie put the spotlight on genetic screening. All chose preventative surgery after finding out they carried a mutated BRCA gene, which greatly increases the chance of developing breast cancer.
About 5, maybe 10% of individuals that have breast cancer, it is something that runs in the family or can be inherited, like BRCA1 or BRCA2. Certainly there's been a heightened awareness about BRCA testing, knowing your family history, but again, not everyone should be having this genetic testing. It's reserved for those who have a very significant family history.
Who should pursue getting genetic testing?
Depends on personal factors as well as family history of cancers. Individuals that have maybe 3 or more people with the same exact type of cancer on one side of the family.
Sarah Carroll, a certified genetic counselor at the Hospital of Central Connecticut, says other red flags include the diagnosis of breast, ovarian, or colon cancer before the age of 50.
Most of the time, genetic testing for hereditary cancer syndromes is a blood test.
Carroll advises patients about their cancer risk once they obtain a family medical history.
So this is a family tree. On this page, squares are males and circles are represented by females. And in these families that have these red flags, it's possible that there's a single gene that's been inherited from mom or from dad that's being passed on through the family. We can use the family history as well as those test results to tailor the patient's screening and surveillance protocols.
It's all a result of the hospital's Catherine Ann King Rudolph Hereditary Cancer Genetics Program, founded in 2009.
So fortunately, here at the Hospital of Central Connecticut, there's no charge for the genetic counseling process. This is due to, in part, by the very generous grant that we have.
Now with testing, an underlying genetic cause can often be determined.
And then we can offer a yes or no kind of test to provide that information to their children, sisters, brothers, nieces, nephews, to see who in the family is also at high risk and who needs the extra screening and surveillance.
These exciting advancements are making a huge difference in patients' lives.
Correct. I'm very passionate about what I can do and what I can provide for patients as well as their families.